In this podcast episode, Dr. Chris Palmer, who is associated with Harvard Medical School and McLean Hospital, focuses on exploring the relationship between metabolic dysfunction and mental disorders, specifically depression. Dr. Palmer emphasizes that while all humans may experience feelings of anxiety and depression at some point in their lives due to life circumstances, there is a distinction between normal emotional responses and actual brain disorders that lead to persistent and unexplained symptoms. Dr. Palmer explains that individuals with functional lives who experience depression despite having no apparent reason to be depressed likely have brain disorders. These brain disorders cause the brain networks responsible for triggering depression to malfunction, leading to symptoms such as overwhelming sadness and feelings of being a burden. On the other hand, individuals who have chaotic lives, lack stable relationships, and struggle to form connections with others may also experience depression as a natural response to their circumstances. In this case, depression serves as a signal for the brain that something is wrong in terms of social integration and connection with others. In exploring potential physiological contributors to depression, the conversation touches on various factors such as excess immunological activity, dietary imbalances, toxin exposure, adverse reactions to medications, lack of physical exercise, and even alcohol withdrawal symptoms. Dr. Palmer highlights the importance of ruling out medical conditions such as neurological disorders, hormone imbalances, and other illnesses that can manifest as symptoms of depression, showcasing a direct link between physiological health and mental well-being. Dr. Palmer's approach to understanding and treating mental disorders, particularly depression, takes a unique turn towards metabolic dysfunction. His interest in this area was sparked by observations of significant improvements in psychotic and mood symptoms in a patient with schizoaffective disorder who was placed on a ketogenic diet to aid weight loss. The patient not only shed excess weight, but also experienced a remarkable reduction in hallucinations and delusions, leading to improved functioning and engagement in daily activities. The ketogenic diet, known for its role in weight loss and as a fad diet, has a long-standing history in neurology as a treatment for epilepsy. Dr. Palmer delves into the connection between the ketogenic diet and improvements in brain function, drawing parallels between its effectiveness in treating epilepsy and its potential benefits for mental health conditions like depression. He highlights the use of epilepsy treatments in psychiatry and the overlap in medication usage for seizures and various mental disorders, emphasizing the significance of metabolic interventions in addressing underlying brain dysfunction. By focusing on metabolic dysfunction as a common pathway for various contributors to mental disorders, Dr. Palmer suggests a shift towards recognizing the role of metabolism in shaping brain function and mental health outcomes. He underscores the need for a more comprehensive approach to diagnosing and treating mental illnesses, considering the intricate interplay between biological, psychological, and social factors. Dr. Palmer's research and clinical experiences shed light on the potential of dietary interventions, metabolic therapies, and a deeper understanding of brain metabolism in improving outcomes for individuals with mental disorders. Mitochondria are known as the powerhouse of the cell, responsible for converting food and oxygen into ATP, which fuels the body. However, recent research has shown that mitochondria have a broader range of functions, including the production, regulation, and release of neurotransmitters such as serotonin, dopamine, and GABA. They also play a role in controlling gene expression, inflammation, and the synthesis of hormones like cortisol and testosterone. Mitochondrial dysfunction can lead to neurotransmitter imbalances, epigenetic changes, inflammation, and hormonal imbalances, all of which are linked to mental health disorders. Trauma and childhood adversity can directly impact mitochondrial health, highlighting the connection between biological, psychological, and social factors in mental illnesses. The ketogenic diet mimics fasting by tricking the body into a fasting state while still providing adequate nutrition. Fasting and fasting-mimicking diets like the ketogenic diet promote autophagy, the self-devouring process that clears out old and defective cells, including damaged mitochondria. This can lead to reduced inflammation, improved mitochondrial repair, and overall healing in the body. Fasting has been used for centuries as a healing intervention in various cultures and religions. The practice of fasting can help to reduce inflammation, promote autophagy, and support the body's natural healing and repair processes. By tapping into the body's innate ability to heal, fasting can have profound effects on overall health and well-being. Dr. Palmer shares anecdotes of patients who have experienced significant improvements in their health by adopting dietary interventions. He mentions a woman with bipolar disorder who achieved remission after switching to a ketogenic diet, as well as a young man with severe bipolar disorder whose symptoms disappeared within months of starting the diet. These success stories highlight the potential of metabolic-based interventions in managing mental health conditions that were previously deemed treatment-resistant. Dr. Palmer references ongoing clinical trials at prestigious medical institutions focusing on the metabolic aspects of mental health disorders like schizophrenia and bipolar disorder. He collaborates with a team of experts to advance research in this field, supported by philanthropic contributions towards establishing the Metabolic and Mental Health Program at McLean Hospital. The aim is to explore metabolic strategies for treating mental illnesses and provide hope and practical solutions for individuals struggling with these conditions. The discussion with Dr. Palmer points towards a paradigm shift in mental health treatment, where metabolic-based approaches offer new hope for individuals with treatment-resistant conditions. By recognizing the connection between metabolism, mitochondria, and mental health disorders, healthcare professionals can explore innovative solutions that go beyond traditional psychiatric medications. Dr. Palmer's work showcases the potential for dietary interventions to transform mental health outcomes and offers a beacon of hope for those struggling with chronic psychiatric conditions.